Okay, so today I'm going to talk about infections of the urogenital tract. This is going to include both the urinary and the reproductive tracts. The urinary system is going to consist of your kidneys, ureters, bladder, and urethra. Infections tend to be prevented by backflow to the kidneys, which will help by preventing that backflow. Valves will help with that. Urine is acidic, and then you also have the mechanical flushing of urine as well. Typically speaking, the urinary system is a sterile site, and there is no microflora that's present there, or microbiome that is present there. And that's an area that we do want to make sure that does stay sterile. If you do have something growing as far as bacterial or even fungal, that is considered an infection. And you'll see the most common type of UTI, which is urinary tract infection, is caused by E. coli. Females, unfortunately, they are going to be much more likely to develop a UTI versus their male counterparts. It's actually almost about a 10-to-1 ratio. And it's estimated that about 40% of females that get catheterized, especially in a hospital setting, they will actually develop a UTI. And the reason for this is that females have a very short urethra compared to males, and also the proximity to the anal rectal area. Now, the GI tract does have lots of E. coli present, and that's where it lives. It's part of the microbiome of the GI tract. However, sometimes if that E. coli does find its way into the urinary tract, that's when you actually have a little bit of a problem causing that UTI. As far as the female reproductive tract is concerned, you have 2 ovaries, uterine tubes, uterus, cervix, and vaginal tract. The vaginal tract, cervical region, and the external genitalia will have microbiome present. As far as upstream structures beyond that, they should be sterile. On the male side, you have the 2 testes, the accessory glands, penis, epididymis, vas deferens, ejaculatory duct, and urethra. The male reproductive system should be sterile all the way through the entire system. Obviously, the external surface of the penis is going to have normal flora that you would find on the skin. Okay, so the urinary tract should be sterile. The vaginal tract will have lots of microbiome present. The predominant bacterial species in the vaginal tract is going to be lactobacilli, and the predominant actual fungal species will actually be Candida species. So looking at urinary tract infections, cystitis, this is actually an infection of the bladder. Urethritis would be an infection of the urethra. And pyelonephritis would actually be an infection of one or both of the kidneys. It's rare that both would actually be infected at the same time. The usual causative agent for UTI is E. coli. Okay. Symptoms for UTI is dysuria, which is difficult or painful urination, and pyuria, which is pus that's found in the urine. And treatment is with antibiotics. If you start off with a bladder infection, it can obviously lead to urethritis, but it can also progress up to the kidneys, which is pyelonephritis. This is a little bit serious because this could actually cause the kidneys to shut down, which will require IV antibiotics, but also flushing the kidneys out to sort of get them started back up again. Usually people that have pyelonephritis and the UTI has sort of progressed up to that point, they'll have pain in their lower back or flank region. Okay, I don't know why the picture is on top of the words here. But another urinary tract infection is leptospirosis. This is actually caused by Leptospira interrogans. The reservoir for leptospirosis is actually dogs and also rats. Dogs actually can get this, especially if they're outside and they're sort of licking a urine contaminated puddle. especially from, say, maybe a rat that may have contaminated it. This is a spirochete bacteria, as you can see in the picture here. That's sort of blocking everything else. But humans can also get this. There is actually a vaccine for leptospirosis for dogs, but it's not that prevalent in humans, as you sort of have to drink urine-contaminated water to sort of get this. The reason why this is under the urinary tract is that symptoms for leptospirosis will cause a headache, muscle aches, fever, kidney failure, which could potentially lead as a complication for this. And treatment for leptospirosis is doxycycline, which is a very common antibiotic that's been around for decades. Okay, so let's talk about the sexually transmitted infections. They are prevented by condoms, and bacterial infections are treated with antibiotics. Viral infections are a little bit more problematic, especially if they are persistent. The viral infections, as you are well aware from Chapter 13, is that viruses cannot be treated and gotten rid of. Once you are infected with a virus, you are infected with that virus for the rest of your life. But with some of these viral infections, such as HIV or hepatitis or herpes, we can sometimes manage the outbreaks or flare-ups. So looking in the United States, there is approximately 110 million individuals who have been infected with an STI. The most common type of STI in the United States is HPV, at 79 million. The next most common is actually herpes, HSV2, at 24 million. And then you can see the breakdown. We actually do have almost about 1 million people in the United States infected with HIV, and about 500,000 with hepatitis B. And again, these are all viruses. The good news is that we have an HPV vaccine that has been employed for about 10 to 15 years now in the general population. And as a result of that, we have been able to see a decrease in that number over more recent years, say from 2010 to 2020. So the first STI is chlamydia. Chlamydia is a very common STI. It's caused by a bacterium called Chlamydia trachomatis. We did see this organism in the first chapter infections of the skin and eye, as this was the leading cause of blindness worldwide, but it's also an STI. In the United States, we see about 1 to 1.5 million cases of chlamydia per year. The female rate is about 2.5 times that of the male rate. This could be due to higher screening of females versus males, but males that are symptomatic most likely will go to the doctor and be tested for this. This is just looking at a trend from 2000 to 2016, and what we can see is that it's on an uptick for both men and for females, males and females. And again, you can see females are much higher versus males. As far as area of the country, there's no huge difference, meaning that there's no real outliers, and you can sort of see this on this map of the US. Again, pretty consistent throughout the country. This is just looking by age group. Again, if you sort of take these numbers as whole numbers, the highest population of individuals where we do see this is in the sorry guys. So the biggest age group that we see chlamydial infections, and this is going to be pretty consistent for most STIs, is 15 to 30. However, the more disturbing fact is that the largest percentage increase that we've seen over the past decade or so has actually been in the 65 plus range. Although it doesn't account for numbers, large numbers, it's where we have seen the significant increase in percentage of cases. is that 65 plus group. And, you know, this has become such a problem for certain areas that the public health departments have had to come up with programs to go to senior citizen homes, nursing facilities, nursing care facilities, to talk about practicing safe sex. The other thing is, and again, with most of these STIs, because these are reportable diseases to the public health departments, we actually do have these nice statistics. The other thing that we typically see with a lot of our bacterial STIs, such as chlamydia, gonorrhea, you'll see this with syphilis, is that there is actually a disproportion in African Americans. And that's what that top line there is. We actually see a lot more cases in African Americans than many of the other races. And that's sort of broken down by here as well. Again, I'm not concerned that you know specific numbers for any of these STIs. I'm just more concerned that you know the trends that we typically see. And then finally, the last statistic that we'll look at for chlamydia is, breaking it down by who you actually have sex with. And one of the things that we've seen, especially over the past decade, is actually an increase in individuals contracting STIs in men who have sex with men. This about population, unfortunately, what happened about 2010, 2011, 2011, around then, is they started to release what's called PrEP, which is prophylactic treatment for HIV. And unfortunately, it got released, well, not unfortunately, but it got released into the men who have sex with men population. And unfortunately, what we saw was a lot of people took that as, I'm on PrEP, I don't need to practice safe sex. And unfortunately, we saw a huge increase in all of the STIs in that particular population of people. Gonorrhea. This is another bacterial infection that is caused by Neisseria gonorrhea. This is a bacterium that can grow and multiply easily, especially within the reproductive tract. Symptoms for gonorrhea, and I forgot to mention the symptoms for chlamydia, but they're the same. Men are going to know something's wrong. They're going to have painful urination, discharge of pus. Women will actually exhibit very few symptoms, but possible complications such as PID. PID is pelvic inflammatory disease, which is pretty much inflammation of most of the reproductive structures. In the US, we see anywhere from 250,000 to 500,000 cases of gonorrhea per year. We do also see a slightly higher rates in females than in males. The problem with gonorrhea, though, is we have seen huge increases in drug resistance. You'll see a slide on that in a second. Looking at gonorrheal rates reported in the US, this goes over a 7-year period here. You can see we've had our peaks, and we are currently in a peak. And what all of these have sort of correlated with, especially in the mid-40s and the 70s there, was the end of World War II and the Vietnam War in 2016. You can come up with your own reasons for why that might be. As far as looking by sex, again, really no huge difference. The only thing that I pull out of this trend line is that if you look from 2010 to 2016, we are on an upward swing again. Looking at area of the country, no huge difference there, no outliers. And then looking by age group and sex, again, sex is pretty evenly distributed, slightly higher in females. But again, by age group, those 30 and younger is where we see the highest numbers. And this is the final slide looking at African Americans, where we do see that disproportion with these bacterial infections. Now, as far as who you have sex with gonorrhea, again, in many of our major cities and states, we have seen with the men who have sex with men category, huge increases especially in the 2016 timeframe. And as I mentioned, the primary reason for this is because of the release of PrEP and a lot of people not practicing safe sex as a result of going on to PrEP. We have sort of done a little bit of a course correction on that. A lot of public health officials have sort of gone back and now have sort of really educated that, you know, just because you're on PrEP, you still need to use a condom, you still need to take precautions. And this is just looking by age groups. Again, that MSN community is really sticking out here. As I mentioned a few minutes ago, gonorrhea does prove to be a huge problem as far as drug resistance is concerned. You know, especially from 2010 to about 2015, we did see huge increases in drug-resistant isolates. This was something that the public health officials also tried to address. And as a result, we are starting to see a decline in the drug-resistant isolates. So that's a good trend. And this is just showing you some of the antibiotics that we did see that resistance with. So PID is something that can be caused in females by gonorrhea and gonorrhea and chlamydia. And essentially it's chronic abdominal pain. This is where it has progressed to the point where most of the internal reproductive structures are infected and inflamed. Because a lot of times these infections go unnoticed in females until they become a more serious problem, you know, this is the unfortunate result. Treatment for this is antibiotic, doxycycline or sulfoxetine. All right, syphilis, this is an oldie. It's been around for many, many years. This does disproportionately affect males over females. The primary stage with syphilis is you'll develop a canker sore at the site of infection. This is a painless sore, and it's noticeable. Hopefully you are treated at that point and you do not just ignore it. If you do ignore it, the canker will sort of heal itself. But then you'll enter into secondary stage syphilis where you'll develop skin and mucosal rashes. After the secondary stage syphilis, if you still have not treated it, you will go into a latency period, which could last for several months to decades. However, if syphilis does return as tertiary syphilis, it would most likely kill you. This is the canker sore that develops, and this is actually on penis here. You can see it. It's quite noticeable. This is the rash that can develop. And this is tertiary stage syphilis, where you'll develop these lesions throughout most of your body, and not just on the surface as shown here on the skin, but this will also develop on, internal organs, and most people die either due to multi-system organ failure or these lesions developing on the brain. This is not something that should happen, especially in the age of antibiotics and treatment. Cases for syphilis, we only see about 10 to 15,000 cases per year in the United States. And again, approximately 75% of those cases is in men who have sex with men category. And this is just looking at those trend lines there. Looking at the US, there's real no difference depending on the area of the country. And again, the areas that we're seeing the highest rate of incidence, these are probably more your metropolitan areas where you just have more individuals. And this is looking at the trend line based on sex and age. Again, that 15 to 30 age range, and at this time it's skewing more towards males. Okay, and then as I mentioned, with all of the bacterial infections, we do see this disproportion with the African Americans having a much higher incidence. Okay, bacterial vaginosis. This is caused by Gardnerella vaginalis. Symptoms for BV will include copious, fishy, gray, white, thin, frothy discharge. You usually see an elevated pH in the vaginal tract. Normal vaginal tract is somewhere between 4 and 4.5. This is a parasitic infection and needs to be treated as such, and they typically will use metronidazole. Herpes. We talked about herpes in the first chapter of this unit with infections of the skin. We talked about HSV1 specifically. This gets into HSV2, or genital herpes. Nationwide, we see about 16.2% of the population, or 1 out of 6 people. Females are much higher incidence than males. And I will tell you, in Philadelphia, that number is actually a little bit higher. In Philadelphia metropolitan area, you're looking at about 1 in 4, 1 in 4.5 individuals that have genital herpes. Majority of genital and perirectal herpes outbreaks in the U.S. are caused by HSV2. Most persons with HSV2 have not received a diagnosis of genital herpes. And what that's saying is that most people don't know they have it because they have not been diagnosed with herpes. Just because you're infected with herpes doesn't necessarily mean you will exhibit the outbreaks. You may not. Case reporting is just not available for most of these unless they are reported to physicians' offices. However, going over a 50-year trend here, or actually going on 70 years in the United States, we just see that if you look at this trend line, you can actually draw a straight line, and there is no ups and downs with herpes. For the past 60 years, it has just been a continuous swing upwards, and we're still trending that way. This is looking by age, and again, the higher the age, the higher the percentage of individuals that are infected with herpes. And that kind of makes sense because if you think about it, if you got it when you're 18, you're still going to have it when you were 50, or you could have contracted it at any age group. So it's not that unsurprising that the older you get, we see that population of people, because they've been around much longer and their risk of contracting it has been a much longer period of time, that we do see that them having the highest incidence. And once you're infected with this, you're infected with this for the rest of your life. And very little change over the decades here, going back from the 70s to 2010. HPV causes genital warts, and there are over 80 different HPV infections, 40 of which can actually infect the urogenital tract. You may be infected with HPV and not actually develop any genital warts, but then again, you may. The problem is not necessarily the warts that develop, but we do have some high-risk strains of HPV, and those include strains HPV 16, 18, which have been linked to causing certain types of cancers, specifically something like cervical cancer, which has been known for a good 3 to 4 decades now. In addition to cervical cancer, we know that HPV is also the causative agent for many other types of cancers, such as throat, anal, penile, and prostate cancers as well. Although the vaccine for HPV, which was developed several years ago and has been out for a good, I would say we're going on almost its second decade now. Meaning we have just started the second decade of the vaccine. The vaccine was initially developed with females in mind, but when that study came out showing that it does cause other types of cancers, we actually saw recommendations to change that, and as a result, both boys and girls get HPV. Now, this trend line looks very similar to that we saw with herpes, but the good news is that this stops at 2010 here. If this was expanded out to 2020, we would actually see a decline. So the vaccinations are actually having an effect here, which is good. And this is just looking at who you have sex with. Again, just know the trends that you see with these various types of STIs, not necessarily the actual numbers. Candidiasis, this is caused by Candida albicans. This is not necessarily an STI. This is just, it is an infection of reproductive structure, the vaginal tract. Males can also get a yeast infection on the penis. But vulvovaginal candidiasis, or yeasty discharge, is a very common infection in females. Most females will actually contract a yeast infection at least once in their lifetime, if not multiple times. With the yeast infections, which you typically see, unlike what we saw with bacterial vaginosis, where we saw an elevated pH in the vaginal tract, with the yeast infections, what you'll end up seeing is a lower pH in the vaginal tract, so less than 4. Remember that the happy vaginal pH is somewhere between 4 and 4.5. This does need to be treated with an antifungal. Most people treat this over the counter with a cream. But if it is problematic or persistent, we do also have oral antifungals such as fluconazole, which is diflucan, which may also be prescribed. Trichomoniasis, this is caused by Trichomonas vaginalis, or T-vag. This is also another parasitic infection of the vaginal tract that can cause irritation and a profuse foul greenish yellow frothy discharge. pH is elevated here, much like we saw with BV. Same drug is used to treat this, and actually it's found in the semen of male carriers who are the ones that are actually infecting the females. So females that get infected with T-vag actually contract it through a male carrier. Now, the male carrier, although they are a carrier, they are not symptomatic, and it does not cause any issues for males. Unfortunately, if you do have a patient that has T-vag, you do need to treat the male counterpart as well, because they can just reinfect the female even after they have cleared the infection. And here's what this guy looks like. And this has actually been pretty consistent over the past 3 or 4 decades as far as the infections are concerned. It is very important that if you are sexually active, especially for females, because a lot of these infections can go unnoticed until they tend to cause more issues than they need to, is that if you are sexually active with multiple partners, even if you are practicing safe sex, you should be tested regularly. And there's a general, what they call the torch panel, which sort of looks for most of these things. The one thing that I did not mention is HIV. We will actually have a whole PowerPoint just on HIV. And I'm actually going to reserve that to the 4th unit, our last unit, when we talk about infection, the immune system, specifically the adaptive immune system. Because that's really what HIV is attacking, is the adaptive immune system. But for HIV, as far as statistics is concerned under this particular chapter, we do see about 1 million cases in the United States per year. It is something that is highly controlled as far as treatment is concerned in the United States, meaning that most people that are infected with HIV today will live a very normal lifespan. That wasn't the case in the 80s and the 90s. If you contracted HIV during those 2 decades, it was most likely a death sentence for you. But like I said, we will come back to HIV when we get to the adaptive immune system. Also, HIV treatment. We'll talk about that. And testing. HIV testing is not part of a normal STI panel. It's something that does have to be requested. Okay, enjoy the rest of your day, guys, and hope you enjoyed the lecture.